1/3 of your life happens while you are unconscious. You cannot feel what your spine is doing. You cannot feel what is happening to the nerves in your arms, the blood vessels in your legs, or the joints in your hips. You simply wake up and either feel reasonably restored or carry forward 8 hours of structural damage from a position your body was never designed to hold that long. For most of your life, sleeping position was a minor concern. After 60, it becomes something else entirely. The discs between your vertebrae are thinner than they were at 40. Cartilage holds less fluid. The muscles that normally guard your spine during movement are completely inactive while you sleep. And so the position you have been falling into for decades, the one that felt comfortable at 35, now acts directly on structures that are already under greater strain than they once were. Japanese orthopedic physicians have documented this shift more thoroughly than most Western practices, in part because their clinical history spans a wider range of sleeping postures: floor futons, elevated mats, transitional positions between traditional and Western styles. Their consistent observation across decades of rehabilitation work, after 60, the same position that produced no meaningful harm at 30 becomes a source of compounding structural damage. The mechanism does not change. The tolerance does. The 5 positions in this video are responsible for a recognizable and specific pattern of harm. Neck pain that will not resolve no matter how many pillows you try. Lower back stiffness that costs you the first hour of every morning, the hour you spend waiting for your body to catch up with your day. Shoulder pain so persistent it gets blamed on arthritis. And a numbness in the hands and feet that enormous numbers of older adults have simply accepted as something the body just does now. In most cases, it does not just do this, it is position, and it can be corrected. When I say worst, I mean worst, specifically for the body after 60. A younger person may sleep on their stomach for years without meaningful consequence. The discs are fuller, the muscles more elastic, the recovery window shorter. After 60, none of those things hold the way they once did, and the same position, held for the same duration, produces a different result. That is not a warning. That is just anatomy. For each position, I will tell you exactly what to do instead. But I am saving the most important one for last, because it is also the most counterintuitive. The position that causes the most consistent structural damage in adults over 60 is one that a significant number of physicians actually recommended as a remedy for back pain. We will get to that at the end, and when we do, it will likely change something about tonight. Before we begin, leave a comment and tell me your age and where in the world you are watching from. Here are the 5 worst sleeping positions for seniors, and what to do instead. Position 1, sleeping on your stomach. Consider what has to happen to your body for stomach sleeping to work. Your face must turn to one side, fully rotated, and hold that rotation for hours at a time. Your cervical spine, the 7 vertebrae in your neck, is designed to tolerate rotation in short intervals during waking movement. It is not designed to sustain a single extreme rotation under the weight of your skull for 7 or 8 hours without relief. At 30, the discs between those vertebrae are plump enough, and the surrounding muscles elastic enough to absorb that sustained stress without producing lasting damage. After 60, neither of those conditions holds the way it once did. There is a second problem that receives less attention. When you lie face down, your lower back arches upward. The lumbar spine, the curve in your low back, is forced into extension, meaning it is compressed at the back of each vertebral joint. For a younger spine, this is uncomfortable. For a spine with any degree of degenerative change, which describes the majority of adults over 60, that sustained compression directly aggravates the joints and the nerve roots that pass through them. The result is the deep, dull, hard-to-locate lower back pain that is worst upon waking and takes the first hour of the morning to ease. Many people attribute this to age. It is, in most cases, position. The fix is straightforward. Transition to side sleeping with a pillow of medium firmness supporting the natural curve of your neck, not pushing your head upward, not allowing it to drop. If stomach sleeping is deeply habitual and difficult to break, place a thin, flat pillow under your pelvis rather than your head. This reduces the lumbar arch and significantly decreases joint compression while your body adjusts to a new position. Position 2. Flat back, sleeping without lumbar support. Back sleeping has a reputation. It is widely described as the neutral position, the safe choice, the posture recommended by physicians. That reputation is partially deserved and partially misleading in a way that matters considerably after 60. The lumbar spine has a natural inward curve. When you lie flat on your back on a firm surface with your legs extended, that curve is suspended in the air. The mattress supports your upper back and your pelvis, but the space between them, the lower back, receives no support at all. The muscles that normally maintain that curve during the day are relaxed, and so the lumbar spine slowly flattens against the bed. The joints in the lower back are pulled open at the front and compressed at the rear, and by the time several hours have passed, the tissues in that region have been held in a mildly distorted position long enough to generate the morning stiffness that so many older adults have come to treat as inevitable. The correction is simple. Place a firm, rounded pillow or a purpose-made lumbar roll beneath your knees. This small adjustment tilts the pelvis slightly, allows the lumbar curve to relax into its natural position, and removes the sustained pull on the lower back joints entirely. Back sleeping, done with this one addition, is one of the better positions available to you after 60. Without it, it quietly works against you every night. Position 3. The tight fetal position. Most people who sleep on their side believe they are doing the right thing, and in principle, they are. But there is a version of side sleeping that most people actually default to, and it is doing real damage. It is not side sleeping. It is the tight fetal position. Knees drawn high toward the chest, chin tucked toward the sternum, spine curved into a pronounced C shape held for 8 hours at a time. The difference between the two is not subtle. Over years, it becomes visible. Japanese rehabilitation physicians who work extensively with older adults have observed a consistent pattern: patients presenting with hip flexor tightness, recurring thoracic pain, that is, pain in the middle and upper back, and morning stiffness that takes unusually long to resolve are disproportionately tight fetal sleepers. The reasoning is straightforward. The hip flexors, a group of muscles running from the front of the lumbar spine to the top of the femur, are already prone to shortening with age and reduced activity. Holding them in a maximally contracted position for hours overnight accelerates that shortening. The thoracic spine, when held in deep flexion, compresses the front edges of the vertebral discs, the same mechanism that, over years, contributes to the forward-stooped posture many older adults develop and struggle to reverse. The tight fetal position and flat back sleeping both affect spinal alignment, but they do so at different segments and in opposite directions. Flat back sleeping pulls the lumbar curve open. The tight fetal position compresses the thoracic spine and locks the hip flexors short. They are distinct problems with distinct corrections. One change fixes most of it. If you are a side sleeper, keep the knees bent at roughly a 90-degree angle rather than drawing them tightly to your chest. Place a pillow between your knees. This single addition keeps the pelvis level, prevents the top hip from rotating inward, and removes the lateral strain from the lower back. Your spine should be roughly straight from neck to tailbone, with the natural curves present but not exaggerated. Position 4. Side sleeping without shoulder support. Correcting the fetal position, as described above, solves the spinal and hip flexor problem. But there is a second structural failure in side sleeping that the knee pillow does not address, and it affects a part of the body that older adults consistently underestimate as a source of nightly damage: the shoulder. When you lie on your side, the shoulder underneath you bears a significant portion of your body's weight for the entire duration of sleep. At younger ages, this is tolerated reasonably well. The rotator cuff, the group of 4 muscles and their tendons that stabilize the shoulder joint, is robust enough to absorb that sustained compression without generating lasting inflammation. After 60, the rotator cuff tendons have typically thinned. The bursa, the small fluid-filled sac that cushions the joint, is less resilient, and the shoulder is being asked to sustain a load it was not designed to hold in a fixed position for 7 hours at a time. That accumulation shows up as a specific and recognizable pattern of shoulder pain. It is dull rather than sharp. It is present upon waking and often worst when reaching overhead or behind the back. It is frequently attributed to arthritis or to general aging. A clinical trial published in the Journal of Pain Research examined adults over 65 presenting with chronic shoulder pain of unknown origin. Researchers found that in a significant portion of participants, the pain was positionally driven, generated or substantially worsened by sustained shoulder compression during sleep, and resolved meaningfully when sleeping surface and pillow configuration were adjusted. Not with medication, not with physical therapy, with position. The mechanism is worth understanding because it explains why the correction works. When the shoulder is compressed against a mattress for hours, the blood supply to the rotator cuff tendons is reduced. Those tendons, even in healthy adults, have a relatively poor blood supply to begin with. It is one of the reasons rotator cuff injuries heal slowly. Sustained compression makes that supply worse. The tissue becomes mildly hypoxic, meaning it is not receiving adequate oxygen, and low-level inflammation accumulates across weeks and months. For many older adults, this has been happening every night for years. The goal is to unload the shoulder, not just reposition around it. There are two reliable ways to achieve this. The first is to use a mattress with enough give at the shoulder, memory foam or a softer latex layer, that the shoulder sinks slightly rather than bearing the full lateral load. The second, which works on any mattress, is to adjust your arm position. Do not tuck the lower arm beneath your body or extend it straight out ahead of you. Instead, allow it to rest angled slightly forward, with a low pillow supporting the weight of the upper arm. This distributes the load away from the joint itself and allows the rotator cuff to remain in a decompressed position throughout the night. There is one further detail that is easy to overlook. The pillow supporting your head in side sleeping must fill the full distance between your ear and the mattress. If it is too thin, your neck angles downward toward the mattress all night. If it is too thick, it angles upward. Either deviation places sustained lateral stress on the cervical spine, the neck vertebrae, and produces the kind of neck stiffness and referred headache that many older adults have normalized as simply how mornings feel. It is not how mornings have to feel. Position 4, then, is correctable with two adjustments: arm position and pillow height. Neither requires any equipment beyond what most people already have, and both, implemented consistently, typically produce a noticeable change within 1 to 2 weeks. That brings us to the final position, the one I mentioned at the beginning, the one that is causing structural damage in a large number of older adults, not because they stumbled into a bad habit, but because someone in a clinical setting told them it was safe, in some cases told them it was beneficial. Position 5, sleeping in a recliner or semi-reclined position. Recliners became a common physician recommendation for older adults with lower back pain and acid reflux. The logic was sound on its surface. An elevated torso reduces reflux. A reclined position takes compressive load off the lumbar discs. For short periods during the day, for specific purposes, both of those things are true. The problem is what happens when a position designed for temporary relief becomes a primary sleeping surface for 7 or 8 hours at a time. You may be skeptical. It is a comfortable position. Many people report sleeping better in a recliner than in their bed, particularly if they have back pain or breathing difficulties. That subjective sense of comfort is real. It does not reflect what is happening structurally. When you sleep in a recliner, your hips are held at a fixed angle, typically between 90 and 110 degrees, for the entire night. The hip flexors, which we discussed in the context of the fetal position, are again shortened and held there. But in a recliner, there is an additional problem that the fetal position does not produce. Your body weight is distributed unevenly across the sitting bones and the lower back simultaneously. The lumbar spine is not supported in its natural curve. It is either pushed into flexion by the seat back or left unsupported in a position that varies every time the person shifts. And the head, in most recliner sleeping, falls forward, placing the cervical spine in sustained flexion for hours at a time. A study published in Spine examined adults over 60 who were regular recliner sleepers, meaning they used a recliner as their primary sleeping surface for more than 4 nights per week. researchers found significantly elevated rates of disc wear in the neck vertebrae, hip flexor contracture, a shortening of the hip flexor muscles that makes it increasingly difficult to stand fully upright, and a loss of stability in the lower back, compared to age-matched adults sleeping in beds. What made the findings particularly striking was the timeline. Meaningful structural changes were measurable within 18 months of regular recliner sleeping. Not decades, 18 months. Think about what that means in practical terms. If you have been sleeping in a recliner for the past 2 years, the stiffness you are already noticing in the morning may not be the beginning of an inevitable decline. It may be the result of a position that can still be changed. But the window matters. Hip flexors that have shortened take real work to lengthen again. The forward lean in the posture that develops takes longer to undo than it took to form. The person who struggles 5 years from now to get up cleanly from a chair, or to keep up on a walk with their grandchildren, or to carry groceries up a flight of stairs, that is not a fixed outcome. But it becomes more fixed the longer the position continues. The reason mainstream medicine was slow to flag this is the same reason it missed several other positional harms. The large studies were measuring pain scores and functional outcomes, not imaging the cervical spine or assessing hip flexor length in recliner users specifically. The population was not being studied at the right level of detail. That does not mean the recommendation was made in bad faith. It means the data was incomplete. The path forward depends on why you ended up there. If you are sleeping in a recliner because of back pain, the underlying issue is almost certainly one of the 4 positions described earlier in this video, or a mattress that is either too firm or too soft to support your specific spine. Address the root cause rather than managing it nightly with a position that introduces new structural problems. If acid reflux is the reason, a wedge pillow placed beneath the upper body in bed achieves the same elevation as a recliner without the hip flexion, the cervical loading, or the unsupported lumbar spine. Wedge pillows are inexpensive, widely available, and do not require replacing your sleeping arrangement. If mobility issues make getting in and out of bed genuinely difficult, an adjustable bed base, the kind that elevates the head and foot independently, provides the positional flexibility of a recliner with the structural support of a proper sleep surface. It is a more significant investment, but it is the correct solution rather than a compromise. So let's bring it all together. 5 positions, 5 patterns of damage that have been quietly accumulating, in most cases, for years. Stomach sleeping twists the neck for hours and compresses the joints in the lower back. Side sleeping without shoulder support loads the rotator cuff all night, quietly and cumulatively. Flat back sleeping without a pillow under the knees suspends the lumbar curve and pulls the lower back out of position while you rest. The tight fetal position shortens the hip flexors and rounds the upper back every night. And recliner sleeping, the one that felt like the safe choice, the one that was sometimes recommended, may be the one doing the most structural damage of all. Full details on pillow placement, wedge angles, and knee support are in the description below this video. Everything is written out clearly, so you can refer back without rewinding. These are not dramatic changes: a pillow between the knees, an adjusted arm position, a wedge under the upper body, small corrections applied consistently that work while you sleep rather than asking anything of you during the day. That is a reasonable exchange for 8 hours of genuine recovery. If this video changed how you think about tonight, leave a comment telling me which position you have been sleeping in and which correction you are going to try first. If someone you know has been waking up stiff and in pain for years and has never considered that their sleeping position might be the cause, share this with them. It costs nothing to change a position, and for many people, it changes everything about how the next day begins. Thank you for watching. I will see you in the next one.